What makes a good day in the life of a cardiologist? It's a very good question. For me, not only making people feel better and feel better about themselves, but oftentimes getting thank yous and gratitude from patients themselves is really the most rewarding part. That makes a good day. There are many problems within cardiology that are not cured but are treated over the long term. There are a number of problems that can be cured as our knowledge and technology has improved. Many cardiac diseases that in the past we just treated over the long term are now curable treatments. Most times when patients come to see a cardiologist, they're somewhat frightened, and I try to allay those fears and get people to be comfortable so that we can have a good relationship right off the bat and get to what the problem is and how to solve it. Patients' families are oftentimes very important. In fact, it's not uncommon for patients to arrive with family members, not just spouses, but sons and daughters and aunts and nieces and nephews. I think that patients utilize family members as support mechanisms, especially older patients who have trouble understanding some of the more technical aspects of diseases and treatments and therapies and medications, etc. Oftentimes it's very helpful to have a family member there to help explain things and sort things out. There needs to be very good communication back and forth between the specialist and the primary care physician so that the patient knows exactly what they need to do, where everybody's coming from, and gets the best possible treatment. Many diseases in cardiology are hereditary, and it's not uncommon that as part of the history taking, we delve very deeply into what the family history is in terms of cardiac diseases. And oftentimes, depending on what the diagnosis is, sometimes patients need to bring their children to see physicians to be screened for possible hereditary diseases. I think that there is a nice collegial spirit. There's a lot of talking back and forth between the physicians. It's nice to be able to just go upstairs or down the hallway and talk face-to-face with a referring physician about a patient, about a problem, and get feedback.